Hi, I'm Dr. Craig Castanet. I'm going to explain to you why people have neck and back pain and the most effective way to treat this. I'm going to use a model for illustrative purposes. This model right here represents two vertebrae in the low back. This could be in the neck as well. Most of what I say will pertain to both regions. This represents two vertebrae. There's a disc in between, as you may know. This represents a disc above as well. If I turn this over and you look at the disc in cross-section, there are two components. There's an outer, tough, fibrous ring called the annulus fibrosus. There's an inner, central, more water-consistent or gelatinous component called the nucleus pulposus. Those are not important, but what is that over time, the natural history of the disc is as follows. From physical demands, loads, sitting, walking, bending, lifting, playing, all the sorts of things we do as we grow up. We impose loads on these, and during the course of the night, we're dependent on resting for regeneration. Over the course of years, unfortunately, in most people, there's a net degeneration, hopefully not quickly, but in some people quicker than others. That means that these outer fibers tear. The tears start on the inner fibers first. The inner fibers don't have a nerve supply, so they don't perceive pain associated with the physical demands and loads that we live with and impose on our spine. And so oftentimes they're not symptomatic when they can be injurious. As these tears aggregate over time, they start to involve the more peripheral or outer fibers of the disc. These outer fibers do have a nerve supply, and that's typically when we first start to experience neck or back pain. Over the course of years and decades, these can accumulate, and the disc inside can become relatively dehydrated. The tears can accumulate. When that happens, there's a loss of water content. Also, the disc inside becomes more acidic, or the pH lowers. That makes for a hostile environment for the cells in here that are responsible for repair of the disc on a daily basis. Those cells then can die off and reduce in number. We know this from animal studies. Those cells have also been examined to quantify the regenerative functions of them, and the cells then make fewer molecules to repair the disc. So what you have is a progressively hostile environment for the discs and progressive degeneration on a microscopic level to this disc. Over decades, these microscopic changes give rise to visible macroscopic or gross changes to the disc, and then the disc begins to collapse, almost like a tire that's deflating, but in this case, it's a disc that's dehydrating. When that happens, it places more pressure on the bones, the adjacent vertebrae. The bones then become edematous or swollen, and then there's additional impaired circulation across the disc from the adjacent bones. The bones themselves are very vascular. The disc is not. So the disc depends upon nutrition from the bones above and below, which are very vascular. When there's pressure on the bones, they become swollen, circulation is impaired. That further hastens the rate of degeneration of the disc. Over time, as the disc continues to collapse, it puts more pressure not just on the vertebral bodies here, but on these joints back here. The joints then, in response to this excessive pressure, they enlarge, as does the vertebral body here. That results over time in an appearance more like this, with misshapen vertebrae here and enlargement of the joints back here. If I hold these up for you, you can see the difference in the physical appearance of the normal vertebrae here, not misshapen as a result of compressive changes over decades, and this one, which is misshapen. So what to do about this? And let me elaborate a little bit more. These bones, when they enlarge, and these bones enlarge, and there are associated ligaments in here which also enlarge, it makes the space for the nerves on the side and the nerves that are running down this canal smaller. And when the space is smaller for the nerves, they can get pinched either on the side here or in the central canal here. When nerves get pinched, you typically feel symptoms in the distribution of the nerve. So you may feel it in the case of the low back when a nerve is pinched. You can get sciatica, which is defined as pain in the distribution of the sciatic nerve. The sciatic nerve is a very large nerve that starts in your buttock, but is made up of 5 nerve roots in the low back and the sacrum, which coalesce and start in the buttock where they combine, and then they go down the buttock, the thigh, the leg, and the foot, sending off branches for the variety of functions that nerves serve, including reflexes, motor function, and sensation. And so a pinching of this nerve root will cause pain in typical distributions, characteristic distributions in your buttock, thigh, leg, or foot. The way, and I should add, if this happens in your neck, what will happen is you get pain typically that starts in the neck and shoulder area, then progresses to the shoulder blade area, between the shoulder blades, and if the nerve's pinched, you'll feel it into the shoulder and down the arm, perhaps to the fingers of the hand. So what to do about this? And I should say that this process, this natural history I've just described, is what accounts for more than 98% of neck and back pain. It's not because things are out of place. It's not because you're weak, although those can be components of issues also, but those are marginal issues. This simple process is fundamentally what causes the vast majority of neck and back pain, more than 98% of the time. So how do you address a problem that is causing neck and back pain and that is by its nature compressive? Well, most patients, when I explain that decompression is the most effective means of treatment because it's the most logical and direct redress for this problem, say, yeah, that makes perfect sense. And in my 31 years of clinical practice, including 18 years in orthopedics and 4 years in neurosurgery, decompressing the spine and this problem has proven to me to be the most effective means for treating these problems. So what that means is I place people on a table. In this case, I've turned these vertebrae so that the patient is facing face up. I secure their anatomy to the table. The table very gently pulls the anatomy apart to get pressure off of the pain generators in the low back or the neck. And those pain generators are the disc, the joint, and the nerve. Those are the sources of pain. By decompressing all 3 of those pain-sensitive structures, you typically relieve people of their pain quicker than with any other means of treatment, more fully, and longer lastingly. And this is the way we should intervene in neck and back problems during the course of people's lifetimes. Sometimes it doesn't prove effective enough, and occasionally I will need to send people out, probably 5% of the time or less, send them out for injections for the inflammatory component of the pain, and very rarely, probably 2% or less of the time, they may end up surgical. Sometimes you need to remove components of the bone or ligament and decompress the nerve surgically to get it better. Occasionally there are other entities that are less common, such as instabilities associated with degeneration or congenital problem that have to be corrected surgically. Surgery can be a blessing, just like injections can, but for the common, typical neck and back pain, decompression of these painful lesions is the most direct and effective way to treat this problem, the most rational, and that's why it is so much more effective for so many more people with neck and back pain. I've been doing this means of treatment for the last 12 years now, and in the context of my 31 years of practice, it has proven to be by far the most effective tool I've had for the treatment of these problems. If I can help you, please call me, 404-558-4015. My name is Dr. Castanet. If you'd like more information, you can go to my website, backstrong.net. That's one word, backstrong.net. From there, you can link to my YouTube channel if you like. I've got about 60 videos published on a variety of topics, including different pathologies in the neck and the back, as well as surgery, pain management, ergonomic videos telling you how to live with neck and back pain and avoid exacerbating your complaints any more than necessary. There's also some information on the rationale and means to do core strengthening. Strengthening your spine is an important part of avoiding injury, but it does not address this compressive problem and the cause of your pain. So the best means of treatment for pain is to decompress people's spine, and then for relief as long-lasting as possible, you want to make sure you have a strong core to protect these joints. So that is the story of neck and back pain. If I can be of help to you, please call me, 404-558-4015. Thank you.